Hello, 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 Facebook. I am Dr. Myla Bennett of Adair Plastic Surgery and Medical Spa in Johns Creek, Georgia. Welcome to my Facebook live video. Thank you all for jumping on with me. We're going to obviously give people just a few minutes to hop on. And in the meantime, the people that are on here, go ahead and share the video. I was going back and forth about whether or not to have this topic specifically because I try not to be too negative, and I just had a deep one, like a serious talk on Sunday, but the reason why I decided to do this video is because I was just watching Love and Hip Hop Hollywood on DVR, and I saw like the aftermath of somebody's aggressive lipo, and I was like, you know what, let me just talk about this. So hi, Dr. Valika. Hi, Norvette. Hi, Brandy. Hi, Shawana. The topic is the pitfalls of aggressive lipo, Shantae. People ask me that all the time. Do you do aggressive lipo? Do you do aggressive lipo? Aggressive lipo, aggressive lipo, aggressive lipo. And so I'm going to go ahead and address that. Oh, thanks, Toya. Thanks, Keisha. Y'all so sweet. Hey, Shamika. You had aggressive lipo. Did it turn out good for you, Sherry? Or did you have issues? Did you get fibrosis or necrosis or contour irregularities or a woody or clay-like looking abdomen afterwards? All the stuff I ever see. You never heard of it? Good. That means you're not like in some of those places that kind of cause issues if you haven't heard of it. It sure does, Dorothea. It sure does. So Dorothea said, does an aggressive lipo cause necrosis? Oh, good. I'm glad yours came out great. So I'm glad, Sherry. That's good. But when you see people, how would I know if I have fibrosis? You can tell, like, it looks like it. When people have fibrosis, their abdomen looks kind of, usually that's where you see it. I mean, I guess you could technically get fibrosis anywhere that you get lipo, but the place that you normally can see it and it's obvious is on the abdomen. Oh, thank you, Cassandra. It's on the abdomen, and the person's abdomen will look like clay or woody, just kind of like to the eye, and not even necessarily just to feel it. It's like, you know, when you look at it, it looks messed with and it looks hard and like just too thin or whatever. Like, it's weird. But aggressive liposuction is basically, you know, taking like almost all the fat in a particular area away. And the average person, it can't. Okay, I'm gonna stop answering questions as I see them because I won't ever get a point out, and I'll come back like I normally do and scroll back and answer the questions because you guys have some good questions on here. But aggressive lipo it tends to be where people will come in and say, take all my fat, and usually the people who are asking for aggressive lipo are overweight. Like, so they might still be within the weight requirement to be able to get the procedure, but usually at the higher end, it's usually not a thin person coming in saying, give me aggressive lipo, because there's really no reason for it. It's people who are trying to lose a whole lot of fat in one setting. So, when you're going around asking for aggressive liposuction, you're asking, it's almost like saying, can you give me fibrosis or can you give me necrosis is the question, because it happens, those complications only happen in aggressive liposuction. I mean, I guess that's not true. Necrosis only happens in aggressive liposuction, or liposuction combined with other procedures in that exact same area. Like if you get liposuction at a tummy tuck in your central abdomen at the same time, that causes necrosis. But necrosis tends to only happen if you did the aggressive thing, because when you get aggressive liposuction, way too much damage is done to the tissues, way too many blood vessels are knocked out, and so then you can't get the best blood supply back to the skin and stuff, and then that leads to tissue destruction and death, which is necrosis. With fibrosis, it's a similar phenomenon. All of the tissues don't die. So the skin doesn't usually die, but a lot of the tissues underneath, it kind of causes like this, because of all the damage, then it's this huge inflammatory reaction that produces way more scar to try to like heal it because it's so much damage. And so then that's when you get these people who are really, really hard, like their abdomen's like really, really hard. Their skin is kind of thin, and the skin isn't like it doesn't look like normal skin, but it's not dead. It's like sick skin, and then it's a whole bunch of scar in it. And so, like it looks irregular. A lot of times with people who get aggressive liposuction on their abdomen, the belly button itself actually kind of sticks out further than the skin, which is not normal because the belly button should be depressed. But in people who have gotten aggressive liposuction to their abdomen, where the surgeon literally like tries to take out every fat cell, then their skin is essentially like laying down straight on the muscle with no fat interface. And even though people think they want all the fat taken away, you really don't, because then it looks abnormal like that. That's what leads to people having fibrosis. And fibrosis is like very difficult to correct. And if it's like your entire abdomen, it's kind of impossible to correct because you can't really put the fat back. I mean, I guess you could try to do fat transfer, but then that's kind of defeating the purpose. And a lot of time it's so scarred down that it wouldn't even really work because you have so much scar in there. It's like concrete. Like, and even if you try to like, go and do like another procedure, it's hard to even separate the tissues because there's so much scar in there. And then if you have one of those situations where you got really aggressive liposuction and a whole lot of tissue damage was done underneath the skin, and then you go and put the garment on, which is necessary after liposuction in order to keep all the swelling from happening, and the skin is the tissues are already like barely making it, and then you go and put a compression garment on and strangulate off the blood vessels that remained, then that's when you end up with faja burns. And it's not really a burn, it's lack of blood supply from too much liposuction. And then when you go and compress it, then it causes the few blood vessels that were trying to keep stuff alive and well, it chokes those off, and then there's no blood supply, so then tissue dies. So this is why when people ask me if I do aggressive liposuction, I tell them no. So the alternative to aggressive liposuction, because you can still get to your result, is just doing more than one round or losing weight first to get to a more appropriate size so that you don't have to go and take away everything. And I never will take away everything. And that's why when you look at my before and after pictures, people look natural. Like if you didn't know the person and all you saw was the after picture and they were in a bathing suit, you wouldn't look at their abdomen and say they had liposuction. You would think they just look nice. But then people who get too much lipo in one setting and they get the fibrosis, you see them in a bathing suit, and a normal person who knows nothing about surgery can look at them and be like, they had something done and it's messed up. Lindsay Lohan had it looked like she had fibrosis and contour irregularities. It was a picture floating around of her in a bikini like 5-10 years ago. It was a long time ago. And she had all those, you can look at her belly and just tell something was done. Like, and it shouldn't be like that. It shouldn't be obvious to a stranger that you had something done. And when you go and try to overdo it in an attempt to get it all done at once, that's when you run the risk for these things happening that are unnatural appearing. And unnatural appearing is a minor problem compared to death of the tissue, and disfigurement. So I guess you would rather have it just look a little abnormal than dead, but why wouldn't you just have neither and just have it look natural? And if you need to get more, then you just have to get more. I think people often are trying to make sure they can get it all in one thing. I don't have time, or I don't want to pay for surgery twice, or all of these different excuses they have to try to rationalize getting too much surgery at once, and they end up with problems that are much worse. So, my patients, I'd rather you be mad at me and feel like I didn't take enough and you still look normal than me overdo it and you have a horrific disfiguring complication. Jackie Henry asks, how much is a reasonable amount of fat one could expect to be removed in a round? That question, honestly, is variable from person to person. So the things that I'm paying attention to when, hi, Myla Domino Britt. The things that I'm paying attention to, Keisha, you can find a lot of before and afters on my on this Facebook page, on my Adarabella Facebook page, and my Adarabella Instagram pages. I actually have more before and afters on my social media than I do on my website, because we always forget to send pictures over to the marketing team. We just like throw them up on Instagram and keep it moving, and then I'm like, dang, those pictures are old on my website. But so you'll see more pictures on my social media than you will on my website. What was I saying? This is why I said I wasn't gonna look at the questions until I was finished talking. What was I saying? I forgot what I was saying. It's all right, girl. That's what you're supposed to do, ask me questions. I just forgot what I was saying. If somebody wants to type what I was saying, then I'll come back to it when you tell me what I was saying, because I forgot. Myrna, it depends on what surgery you had, and it could take up to 6 months for your sensation to come back. But if it's a tummy tuck, it may never come back. Oh, somebody was asking me what's the amount, a standard amount you can expect to lose, fat you can expect to be removed in one round. And the answer to that is variable from person to person. So when I'm doing liposuction on someone, I am paying attention to the canister to assess the amount of blood that's being lost. And everybody is different. So I may do one person take out 3 or 4, let's say 4 liters I take out. I may take, well, actually, I won't take out 4 liters if a person's losing a lot of blood. So let's say, we'll use a smaller number. Let's say I take 2 liters out of somebody, right? I can take 2 liters out of one person and 1,700 of it is pure fat. I can take 2 liters out of another person and 1,000 of it is pure fat. So the other 1,000 is a mixture of fat and blood, but mostly blood. Okay, if I get to 2 liters and I have a liter of blood in the canister, I'm not going to go to 4, because that means you're going to lose 2 liters of blood. And that's how you end up passed out, dead, blood transfusions, that kind of stuff. So I'm not going to do liposuction to the point of killing someone to try to get to a result. So that is variable. It also depends on how big you are to start. So if a person is smaller, if it's a little person who just has like a little pudge or something like that, there's no way I'm going to even strive to take out 3 liters or 4 liters. No way. A person that's really small who just has like a trouble area, I might only take out 700 or 800 and it'll have a dramatic improvement on their appearance. So it varies based on the person's height and weight, distribution of fat, and amount of blood that's lost during the procedure. Jackie Henry asks, how soon after should you do additional rounds? So I will not, the absolute earliest I'll do a second round is 9 months, but usually I make people wait 12. Jackie, you only need a full body garment what do you mean full body? So my garments that I usually put on people go down to their thighs. Unless I'm doing their thighs, and then it'll go down to their knees. And if I'm doing their knees, then it'll go below their knees. Because wherever got liposuction needs to be compressed. How soon you see results, that also sort of varies from person to person, because some people right away you can see what their outcome is going to be like, and then some people you can't see it for months. I had a BBL with Lipo 360, but had a lump, so I went to do doctors for an opinion. Okay, now a lump and fibrosis are 2 different things. So almost every person that gets liposuction has lumps, at some point in the recovery process. But that's what lymphatic massages are good for, and even massaging it yourself at home, because the lumps are a combination of inflammation, swelling, and some scar formation, and a little bit of dead fat. So you're going to have lumps here and there. You shouldn't be able to see them, but you can feel them in firm areas. And that stuff should correct itself over time with massaging. So that's a normal and expected thing to happen. Does aggressive lipo make pregnancy more difficult in the abdominal area? It depends on how severe it is. So if, it depends on if you get a complication from it. So if you get your aggressive lipo and you don't get fibrosis and you don't get necrosis, then it shouldn't affect pregnancy at all. The only way it'll affect pregnancy possibly is if it's really extreme and you have a whole lot of really bad thick scarring that keeps the skin from stretching and, it makes it hard for your belly to expand. Stomach like a walnut, Shantae, that was a person talking about their stomach before surgery. And that was the excess skin and stretch marks and stuff. Thank you, Cassandra. Okay, let's see. Let me go back down the other way. Different surgeons have different BMI. Oh, that was my son. Different surgeons have different BMI requirements for their procedures. In my office, the BMI cutoff for a tummy tuck is 35 is the highest I'll go. And if you're 35 and your weight is distributed not ideally, then I may make you still lose weight, a little weight. For liposuction, my BMI cutoff is 33. For awake liposuction, your BMI has to be 30 or less. If your BMI is between 30 and 33 for liposuction, I won't do it awake in my office. You got to go to the OR and be put to sleep. Yes, Christy, you should be massaging it. Some of the things you can do to prep your body for less blood loss is be careful about the things you take in. So like ibuprofen, which is Motrin, Advil, Aleve, which is naproxen, aspirin, all those things make you bleed. It makes your platelets not work right, and so then you can't clot, which makes you bleed more. A lot of herbs make you bleed, and vitamins actually make you bleed more. So prior to surgery, a week prior to surgery, you should stop those types of things so that your blood is normal. You don't want it to be thinner than normal, and you don't want it to be thicker than normal. So you want to be hydrated. Alcohol makes your blood thinner, so you don't want to be drinking before surgery. Those things. Those are the only things you can do to help that. Some people, even with all of that being said, I mean, everybody is different. So some people, even with all of that, they still bleed more. So the other thing that I do to cut down on bleeding is I let the tumescent solution for awake liposuction, the tumescence, I let it sit for 30 minutes before I start to actually lipo. And that gives you the best chance for the least amount of blood loss. If you sit for 30 minutes and you still are bloody, you were just going to be bloody. Like I can't, that's the most I can do. So then we have to play the hand we're dealt and do what's safe for you at that time. Why would one person have more blood mixture than the next? Because every human being is different. People's diets are different. Your physiology is different. Like it's the same way one person might get a cut on their arm and it heals and you can't see it, and another person might get a cut on their arm and they heal with a keloid. It's why one person gets cancer and the other one doesn't. It's why one person is allergic to aspirin but this person is not. Humans are different. Everybody's not the same. That's why. Because everybody's different. Yes, Myrna, you can get massages as long as you need them. There's no time limit on it. If you're still feeling firm areas and stuff like that, you can still keep getting massages. Janae Sweets, the amount of fat for BBL totally depends on the size of the person to start, the size of their butt to start, how big they want to be. That's another question that's not a one size fits all. "63 days and counting, Carla." All right, let me see. I think I answered all the questions. Yep, Keisha, I'm always thinking about my clients. Like, I tell them beforehand, I'd rather you be mad at me and alive than snatched up and dead. So I do what's right, But the thing is, depending on where you are, you just need to have realistic expectations. And if it's something that you want and the doctor says, it might take more than one round or whatever, then you should be receptive to that and not trying to force the issue, because people forcing the issue on certain things is how they end up dead or hurt. So when you're thinking about inconvenience, there's nothing more inconvenient than dying to your family, your children, your spouse, or you're trying to rush and force all the things to happen at once because you don't want to take no more time off, or you don't want to get put to sleep again, or whatever reasons you rationalize why you want to force all the things to happen at once if what you need is more than one surgery. That's those inconveniences that you're trying to avoid are much less inconvenient than you dying or being hurt. Like, there's women who have been brain dead, or have brain damage from getting plastic surgery, trying to do too much or going to places that aren't safe because they're trying to save money and stuff like that, So even if you don't die, you might end up with something bad or getting horrific wounds and dead tissue. So then they're nursing a wound back to health for 6 months or a year. Like, you will be like, dang, I wish I'd have just got 2 surgeries instead of aggressive whatever. People getting blood transfusions, that's not normal to get blood transfusions for a cosmetic procedure. That's not normal. That's not normal. I don't care what you heard in those groups, and I don't care what these people tell you. It is unacceptable for people to be regularly getting blood transfusions for liposuction. That is ridiculous. That's ridiculous. That's somebody that's watching all this blood come out of you and don't give a crap. Like, it's not a heart surgery. You're not getting a aneurysm repair. So why are you losing that much blood for something you don't need? You just want it for something that just makes you look better. It's not making you, like, when we do these major surgeries, I don't do those surgeries anymore, but those major surgeries like, heart surgery or liver transplants or surgeries where we know you're going to lose a lot of blood and so you get blood products, those surgeries are to save your life. You shouldn't be getting no liposuction or no tummy tuck within an inch of your life. That's ridiculous. It's better to have a big belly and be alive. So if you're getting so much surgery that you need blood transfusions, you probably should not have been getting all that surgery. And a lot of really ridiculous things have been normalized. And so then ladies are like, oh, that's a part of surgery. It's not. It's not a part of cosmetic plastic surgery. You should not. If somebody is routinely transfusing people, I think that person is doing way too much, because I know in my training, we were taught not to do stuff like that. It's unethical. You don't need it. You just want it. And if you're to the point that you need a blood transfusion, then that means either you started off too low, and so then you had no room to lose any blood, or if you start off normal and you get to the point where you need a blood transfusion, that person did way too much. Now, if you get into a bleeding complication where like something happened and you weren't able to stop the bleeding and they lost a lot of blood like that, that's one thing. But a person who is routinely transfusing people for cosmetic procedures, that tells me that they are routinely not giving a damn about watching the blood flow out of these people's bodies and doing too much. That's what that tells me. It's ridiculous. I haven't transfused a cosmetic patient ever. My cosmetic patients don't end up in the ER. Like, none of that stuff happens. Anesthesia. Is it true that anesthesia causes memory issues? No. Like, you might not remember once they give you the medicine. Like, sometimes people will still be awake for like a minute or two after they give you the medicine to put you to sleep. And the patients won't remember that minute. But long-term memory issues, that's not a normal thing that happens with anesthesia. Janae, if you scroll back through my videos, I have a video about that exact topic. Tummy tuck or liposuction, which one do I need? So you should scroll back through my videos and look for that title. Hey, Cavell. Thank you for saying that, but you don't want to be a cosmetic surgeon because that's a fake plastic surgeon, girl. You need to watch my video, Cosmetic Surgeon versus Plastic Surgeon, because a cosmetic surgeon is not where you should be going. Those are fake plastic surgeons. Girl, so you don't want to be that. You want to be a real plastic surgeon. You will be the real deal, right? You're welcome, Regina. Christy, that's not a normal thing. But like I said, every person is different. So that might be how you react to it. But that's not like a normal thing. But every human being is different. Hold on one second, y'all. So. Oh, you saw it? Okay. Okay. All right, y'all. Well, I guess you're welcome, Christy. I guess I'm going to go ahead on and sign off. I talked about J Plasma. It's been a couple months, and I've done 3 people, and they're still shrinking. It's a little like I could see improvement on the table, but it didn't seem like that improvement I saw on the table like persisted. It's kind of like they swell up, just from the procedure itself, and then you got to wait to get back to the results. So it's kind of a slow thing. So I haven't bought that machine because I'm still trying to figure out if I want it. I'm located in Johns Creek, Georgia, which is a northern suburb of Atlanta. Aggressive lipo, Marion, Sweet Pea, you're going to have to watch the replay, boo, because I'm finishing up. Go back and watch the replay. I'm about to get off so you'll be able to watch it, because I'm not about to say the same thing I just said over again. If you get a BBL, just don't let them inject it in the muscle, because that's how people die. Yes, Myrna, that's true. I mean, most people, like, you can see, like, kind of what your result's going to be after about 3 months, but you actually still keep getting slight improvements for up to a year, and depending on your diet, your compression, and the amount of exercise you do, that determines how long it takes for your swelling to resolve. Oh, that's okay, Marion. Just watch the replay because I talked about all of that like at the beginning. So, yeah, I'm about to sign off now, and then you can just go back and watch the replay. Yes, Carla. I have a nurse, a recovery nurse. So, call the office in the morning, and they can, or if you want to, then my office will remember to call you. Just go on my website right now and say, what's the recovery nurse? And then my staff will contact you in the morning with the information. Yeah, I have somebody now. Is what good or bad, Marion? What'd you say? It's bad. Aggressive lipo is bad, in my opinion. The bad things that you see, the bad complications you see from liposuction, usually is because people got aggressive liposuction. So, all right, y'all. So I'm signing off. So I am Dr. Myla Bennett of Adarabella. You're welcome, Marion. I'm Dr. Myla Bennett of Adarabella Plastic Surgery and Medical Spa in Johns Creek, Georgia. And you can reach me on my website at www.adarabella.com, or you can call my office at 678-325-0006. All right, as soon as I type in my website, I'm signing off. All right. Okay. Bye.